Ever heard of methylene blue? I mean, it's kind of a quirky name, right?
Yeah. Doesn't exactly roll off the tongue.
But here's the thing. This stuff has a history. It's like something out of I don't know, a science fiction novel or something. It started out as a dye, for clothes, like way back when.
It's true. Pretty humble beginnings for something that sparked so much interest in the medical field.
Right. And then someone figures out, hey, this stuff stains bacteria. Talk about a game changer, especially back in the day when they were just starting to figure out what caused all these diseases?
Absolutely. It was a huge step forward in microscopy and understanding those tiny little microbes.
And get this, methylene blue has the distinction of being the first fully synthetic medicine ever made. I mean, they created it in a lab from scratch to fight malaria.
It's a remarkable story, a testament to human ingenuity and the power of scientific exploration.
Totally. And that's probably why you're here, right? Curious about methylene blue. Maybe you saw it online or a friend mentioned it.
It's certainly been getting some attention lately.
Yeah, and there's a lot to unpack. So in this deep dive, we're going to do exactly that. We'll break down what methylene blue is, how it works, what it's actually approved to treat.
We'll also look into some of the off-label uses that are generating buzz, and of course, we'll address the safety concerns.
Because that's important, right? Got to make sure we're looking at all sides of the story.
Absolutely. And we've done our homework too. We've got a really in-depth scientific review that delves into the nitty-gritty of methylene blue's mechanisms.
So we're talking about how it interacts with our cells, its effects on energy production, all that good stuff.
Right. And we've also got a bunch of articles that discuss its practical applications and what we know about its safety profile.
So we're combining the hard science with the real-world stuff to give you a complete picture.
That's the goal.
Okay, let's get down to it. What exactly is methylene blue? Besides a dye, I mean.
Well, at its most basic level, it's a synthetic compound. It's created in a lab, not found in nature.
Okay, so definitely not something you're going to stumble across on a hike.
Not quite. Now, chemically speaking, it's got this unique structure that gives it a positive charge, and that makes it really good at interacting with electrons.
Electrons. So we're talking about the tiny particles that zip around atoms, right?
Exactly. And methylene blue's ability to interact with them is actually a key part of how it works in the body.
Interesting. So beyond dyeing fabrics blue, what were some of its early uses? We touched on bacteria staining earlier.
Yeah, that was a huge one. Before methylene blue, science had a hard time seeing bacteria under a microscope.
They were just too tiny and transparent, right?
Precisely. But with methylene blue, they could stain these microorganisms, making them visible. It revolutionized the field of microbiology.
And that led to all sorts of breakthroughs in understanding infectious diseases.
Without a doubt. And of course, we can't forget its use in treating malaria. That was truly groundbreaking.
First lab-made drug ever, for malaria no less. It's kind of mind-blowing when you think about it.
It really is. And it paved the way for the development of countless other synthetic medications.
So fast forward to today. Where does methylene blue fit into modern medicine?
Well, it still has a couple of important roles. For one, it's still used as a diagnostic tool.
Really? It's still being used as a dye. How does that work?
It helps doctors see things more clearly during certain procedures. For instance, if they're looking for abnormal cells, like in cancer.
Because those cells tend to take up the dye more readily, right?
That's right. They absorb methylene blue more than healthy cells, so it acts like a highlighter, making those areas stand out.
Okay, that makes sense. So it's like a visual aid for doctors.
Exactly. And then there's its use as an actual medication. It goes by the name Prove Blue when it's used that way.
Prove Blue. Got it. So what does it actually treat?
Well, it's FDA approved for a condition called methemoglobinemia. It's a bit of a mouthful, but it basically means your red blood cells aren't carrying oxygen as efficiently as they should.
And oxygen is kind of important, right?
To say the least. So in methemoglobinemia, the iron in your red blood cells gets stuck in a form that can't bind to oxygen properly.
So the red blood cells are like, I don't know, delivery trucks that can't unload their cargo?
That's a great analogy. And methylene blue comes in and helps those red blood cells convert the iron back to its normal form so they can pick up and deliver oxygen again.
Okay, so it's directly addressing the problem at the source.
That's the idea. Now, it's important to note that methemoglobinemia can be caused by a couple of things. Sometimes it's triggered by certain medications or chemicals.
Oh, like an accidental side effect of something else.
Exactly. But sometimes it's something people are born with, a genetic condition.
So there are a couple of different ways it can happen.
Right. And methylene blue is approved for the acquired form, the one caused by external factors.
Got it. But our sources also mention that it's used for the congenital forms sometimes, even though it's not officially approved for that.
That's true. While the FDA approval is specifically for acquired methemoglobinemia, doctors sometimes use it off-label for the inherited version as well.
Interesting. So it's not always a one-to-one match between what a drug is officially approved for and how it's actually used in practice.
That's right. Medical practice is constantly evolving, and sometimes doctors find that a medication can be helpful in situations beyond its initial approval. But of course, that should always be done with careful consideration and under the guidance of a qualified healthcare professional.
Absolutely. It's not something to be experimenting with on your own.
Definitely not.
Okay, so we've got the official use down. Now, let's dive into the off-label territory. What are some of the other ways methylene blue is being explored? And it's really important to emphasize that these are not FDA-approved uses. This is more about the research that's happening and potential future applications.
Right. It's all about understanding the possibilities. One area that's been getting some attention is its potential as a cognitive enhancer.
Cognitive enhancer. So we're talking about things that might improve memory or thinking skills?
Exactly. Some studies have suggested that methylene blue might have a positive effect on memory and learning, potentially by boosting energy production in brain cells.
Hold on, we talked about its role in red blood cells, but how does it affect brain cells?
Well, it all comes back to those mitochondria we mentioned earlier. Remember, those are the tiny powerhouses inside our cells that produce energy. And brain cells, they're real energy hogs.
They're constantly firing, sending signals, and processing information.
Exactly. They need a constant supply of energy to keep up with all that activity. And methylene blue, at low doses, seems to make those mitochondria more efficient. It's like giving them a little tune-up.
So it's kind of like supercharging the brain's batteries?
You could think of it that way. And that increased energy availability might help brain cells function better, leading to improvements in memory and cognitive function.
Interesting. So it's not directly targeting memory processes, it's more about supporting the overall energy needs of brain cells.
That's the current thinking. Now, it's still early days for this research, and more studies are needed to confirm these effects and figure out the optimal doses.
Right, we don't want to jump the gun and start thinking of it as a magic memory pill just yet.
Definitely not. But it's a promising area of research, and it highlights the potential for methylene blue to have effects beyond its traditional uses.
And I think we also saw something about its potential as a neuroprotective agent.
Yes, that's another exciting avenue of research. Some studies have shown that methylene blue might help protect brain cells from damage caused by things like oxidative stress and inflammation.
Oxidative stress, that's like rusting from the inside out, right?
That's a good way to put it. It's when harmful molecules called free radicals build up in the body and start damaging cells.
And inflammation is basically the body's response to injury or infection.
Right, but chronic inflammation can be problematic, especially in the brain.
So how does methylene blue fit into all of this?
Well, it seems to have antioxidant properties, meaning it can help neutralize those harmful free radicals.
So it's like a built-in rust protector for the brain.
In a way, yes. And it might also help modulate the inflammatory response, keeping it in check.
That's pretty impressive.
Yeah.
So it's tackling these two major culprits in brain cell damage.
Exactly. Now, again, this is still an area of active research, but the initial findings are encouraging. And if methylene blue can indeed protect brain cells, it could have implications for a whole range of conditions.
Right. We're talking about things like Alzheimer's disease, Parkinson's disease, even traumatic brain injury.
Exactly. Conditions where brain cell damage plays a major role.
So potentially huge implications down the road. But for now, it's still in the research phase.
That's right. It's important to remember that.
Okay, we've talked a lot about what methylene blue might be able to do, but let's shift gears and talk about safety, because that's always a key consideration, right?
Absolutely. No matter how promising a treatment might be, we need to understand the risks and potential side effects.
Exactly. So is methylene blue safe?
Well, generally speaking, yes, it's considered relatively safe when used appropriately and under the supervision of a healthcare professional. But like any medication, it does have potential side effects, and there are some situations where it might not be suitable. Okay, let's break that down. What are some of the common side effects people might experience?
Well, some of the most frequently reported ones involve the gastrointestinal system. Things like nausea, vomiting, diarrhea, stomach cramps, that sort of thing.
Sounds pretty unpleasant.
It can be. But the good news is that these side effects are usually temporary and tend to resolve once the treatment is stopped.
Okay, so more of a nuisance than a serious threat.
Right. Now, some people also experience allergic reactions. These can range from mild, like a skin rash or some itching, to more severe reactions like swelling or even difficulty breathing.
That sounds a bit more serious.
It can be, which is why it's so important to be aware of the signs of an allergic reaction and seek medical attention immediately if you experience anything concerning. Absolutely. And I think we also saw something about potential neurological side effects.
Yes, some people have reported things like headaches, dizziness, confusion, or tremors.
So, stuff that affects the brain and nervous system.
Right. These side effects are less common than the gastrointestinal ones, but there's still something to be aware of.
And then there's let's call it the unique side effect of turning blue, right?
Ah, yes. That's one that often catches people off guard. Methylene blue can cause your urine and stool to turn blue or green.
And I heard it can even temporarily tint your skin a bluish color.
That's true, although it's usually not very noticeable. But it's definitely something to be aware of so you don't freak out if you see it happening.
Definitely. It's good to be prepared. So, those are some of the more common side effects. Are there any more serious risks associated with methylene blue?
Yes, there are a few things to be particularly cautious about. One is a condition called serotonin syndrome.
Serotonin syndrome, that sounds a bit ominous.
It can be. It's a potentially life-threatening condition that can occur when methylene blue is taken with other medications that also increase serotonin levels in the brain.
Serotonin, that's a neurotransmitter, right? Involved in mood and things like that.
Exactly. And many common medications, like antidepressants, work by increasing serotonin levels.
So if you're taking one of those medications and you also take methylene blue, it could lead to too much serotonin in the brain.
Precisely. And that can cause a whole cascade of problems, from agitation and confusion to muscle rigidity and seizures.
That's definitely something you'd want to avoid.
Without a doubt. So it's absolutely crucial to tell your doctor about all the medications you're taking, including over-the-counter drugs and herbal supplements, before you start taking methylene blue.
Right, because even something that seems harmless could interact with it.
Exactly. It's better to err on the side of caution.
Agreed. And I think there was also a specific warning about people with a condition called G6PD deficiency.
Yes, that's another very important one. G6PD deficiency is an inherited condition that affects red blood cells.
Something about how they process oxygen, right?
Exactly. People with G6PD deficiency lack a certain enzyme that's crucial for protecting red blood cells from damage. And methylene blue can actually trigger the breakdown of red blood cells in people with this condition.
So it's a serious contraindication.
Absolutely. People with G6PD deficiency should not take methylene blue.
Got it. And what about pregnant or breastfeeding women?
Generally, methylene blue is not recommended during pregnancy or breastfeeding.
Because it could potentially harm the baby.
That's the concern. It's best to avoid it during those times.
Okay, and I think we also mentioned kidney problems earlier.
Yes, people with kidney issues need to be cautious with methylene blue as well. It's usually avoided in people with severe kidney impairment, and it should be used with caution in those with mild or moderate kidney problems.
So basically, it's a situation where close monitoring by a doctor is essential.
Absolutely.
All right, so we've covered a lot of ground here. What are some of the key takeaways we should remember about methylene blue?
Well, I think the main thing is that it's a versatile compound with a long and fascinating history.
From dyeing clothes to treating malaria to potentially enhancing brain function and protecting brain cells?
It's quite a journey.
Yep.
And it really highlights the unexpected ways in which scientific discoveries can unfold.
It's a reminder that we're still learning, still exploring the potential of even seemingly simple substances.
Exactly. And I think it's also important to remember that methylene blue, while promising in many ways, is not a miracle cure.
Right. It has its limitations and potential risks, just like any other medication.
Exactly. And that's why it's so important to approach it with a balanced perspective, to understand both its potential benefits and its potential drawbacks.
And to always, always consult with a qualified healthcare professional before considering using it.
Absolutely. They can help you weigh the risks and benefits and determine if methylene blue is right for you.
Couldn't agree more. Well, thanks for joining us for this deep dive into methylene blue. It's been a fascinating exploration.
It has been. Always a pleasure to delve into these intriguing topics.
Until next time, keep those minds curious and those questions coming.